Your active life. Over time, your body's joints and connective tissues start to lose strength and resiliency from injuries, overuse, and gravity. Pain, loss of cartilage, and loss of movement can impact how we enjoy life. Often, surgery is presented as the only option to correct these issues. But now, your own stem cells may be a non-surgical answer to restoring your health. Stem cells already exist in your body. They lie dormant until they receive signals to wake up. Like soldiers, they go to an affected area and help cells regenerate and the body heal. Autologous stem cells derive from your own bone marrow and injects them into an injured area. Those stem cells will take their orders from surrounding cells like bone, cartilage, muscles, or other connective tissue, and then develop into that type of cell to repair the injured site. How do you know if you're a candidate for stem cell therapy? Well, everyone has stem cells. Furthermore, physicians will determine your candidacy for stem cell therapy. We'll take your medical history, examine you, and review any existing MRIs or X-rays. Candidates can be anyone suffering from overuse injuries or joint and spinal pain. Even someone who is needing unavoidable orthopedic surgery can use stem cells to improve the outcome. People with multiple sclerosis, fibromyalgia, or other autoimmune conditions can benefit from the use of stem cell therapy to harness their body's own healing power. If surgery is unavoidable, such as for an ACL or shoulder injury, trained surgeons can perform the surgery and use your stem cells in conjunction with the procedure to aid your healing process. During your initial visit, a qualified patient care provider will explain the personalized therapy you will receive and how it can work with your body. They will review all procedures in detail, but in a nutshell, here is what you can expect. We'll ask you to refrain from anti-inflammatory medications 7 days prior to the procedure and 14 days post-procedure. You'll be given an IV anesthesia or conscious sedation. Even though you'll be awake, you'll feel minimal to no pain, and you should have little or no recollection of the procedure itself. An experienced spine surgeon, orthopedic surgeon, or trained physician will remove some of your bone marrow. Your bone marrow will be placed in a device that will isolate the stem cells. Then, your stem cells are injected back into your body, in the area of the injury, to stimulate natural healing. For non-orthopedic conditions, the team will deliver your stem cells intravenously. The entire procedure will take about 45 minutes. You'll be taken to rest in a comfortable recovery area. Trained and friendly staff monitor you for any complications. Stem cell procedures are usually done on an outpatient basis, meaning there's no need for an overnight hospital stay. Most patients walk out of the clinic and immediately resume low-impact activities. A personalized plan will be devised for an aftercare regime, but the most important part of any stem cell therapy is adhering to your post-procedure restrictions. Refrain from anti-inflammatory medication for 14 days. Rest for the first 48 hours. If the therapy was for a specific joint, restrict its use to just basic movements for the first 2 weeks. After 3 weeks, continue low-impact activities. After 3 weeks, walking and low-impact cardio are allowed. And after 4 weeks, weightlifting and running are permitted. For non-orthopedic conditions, you should be able to return to your normal activities after a few days of rest. But pay attention to your body as you resume normal activities. Although rare, report any complications to your doctor. The results? 70% of patients are 70% improved within 1 year. Any stem cell clinic that you may choose, we encourage you to ask for data on the efficacy of the procedures. Founded by fellowship-trained spine and orthopedic surgeons who wanted to provide a non-surgical healing process for orthopedic injuries to the spine, neck, knee and hip joints. It has treated everyone from weekend warriors to former NFL athletes and high schoolers to retirees, with the goal of treating pain and restoring joints, bones and muscles to their optimum performance, so you can return to the activities that you enjoy.
In stem cell therapy, a few FDA-approved, highly effective treatments coexist with an array of unproven, expensive, potentially dangerous procedures done by private clinics. Some proven stem cell treatments are approved by the FDA for specific conditions. The established and successful form of stem cell therapy is hematopoietic stem cell transplantation, such as bone marrow transplants to treat leukemia, lymphoma, multiple myeloma, and other blood and immune system disorders, often with high success rates in managing or curing them. Legitimate clinical trials are underway for neurological disorders and injuries, offering cautious optimism for future approved therapies. Private clinics and providers market unproven stem cell treatments for a wide range of conditions, and no FDA approval. These are often described as a scam by medical experts due to deceptive marketing and patient harm.